Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is, and we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world.
We're here.
We're here.
We're here.
All of our technology works.
We got it working. Oh my God.
It's amazing.
It's been so much.
Oh, it has. It really has. It's been months.
Yeah. Months.
Yeah.
So much work.
Yeah. But our first 4 episodes are out and we'll see how that goes. We're recording it before they launch, but they're ready. They're on the diving board. Yeah. So we'll see how they're received, but we're moving forward regardless.
Yeah. Yeah. I feel like they could be better. We've talked a lot about that, but just moving forward sometimes
that's what has to be done.
It's just what it has to do.
Yeah.
Yeah.
We all have the inner critic that says should be better, could be better, but
no, I've stayed stuck because it can be better for for a long time. So this is push on.
We're pushing on.
I see your cat. I see your cat in the background.
Oh yeah, there she is. She's trying to look out the window, but I got the shades pulled.
Yeah.
She usually gets up. On that shelf.
Yeah.
Well, so how has your week been? It's been busy. It's summertime.
Yeah, it's been busy. I had a patient crump on me recently that was, brought back all the things. It doesn't happen that often anymore. I don't really put myself in the situation to have patients crump, but when they do, that part of me just activates and I go to work. I think it's funny how it feels good. It feels good when you know what to do and the outcome wasn't exactly what I wanted, but he didn't die. So that's good.
There's always that.
Yeah. And I think he got good care down the line. I'm sure ultimately he did. But yeah, no, it was, it's always, that's kind of the joy of working in a critical care setting that isn't ICU or ER. You dip your toes in and you just get them wet a little bit.
It never leaves you. I mean, it clearly it is who you are, and it's just it never leaves.
Yeah,
never leaves. No matter what kind of nursing you're doing, it never leaves.
Yeah, I think we've talked about this before. Like, I always scanning the public.
Yeah,
like
at the Walmart.
Who's gonna go? Who's gonna go down? Yeah.
I had to do. I don't know. It might have been 3 years ago or so. Anyways, we were traveling in the airport back from Florida, and I was sitting, we were getting ready to board the plane or waiting to board. And one of my kids comes running over and they're like, Mom. And I look up and they're like, come on, this guy needs help, whatever. So like, I literally drop my stuff. My hair's in like a messy bun. I have my dress on, my, spaghetti stuff, just travel dress. I run over there and this old guy, his son has got him on the floor. And I'm like, we need to see somebody, please call somebody. Like this guy isn't free. Anyway, I ended up doing CPR until the EMS got there. And so, no matter where you are, and so we just got back from Florida again and we flew. And that was in my mind. I'm like, please, nobody go down on the plane. Nobody tell anybody that I'm a nurse. I don't stop. Now, I was glad that I was there. I was glad that I could help him. I do not know if he survived or not, but I do know that EMS took him from the airport. So, and they had the thumper going on him. So,
oh no, God,
I don't know, violent. But yeah, you just never know what you're going to run into.
Yeah,
you might see a urine bag on a leg at Walmart or in the restaurant, or some kind of wound vac sitting there on the floor. Yeah, you just never know.
The little Foley bag, the leg bag sticking out of the cuff of his pant leg.
Yeah. You never know.
I've had 3 airplane related interventions. 2 in air and 1 on the ground. The one on the ground was absolutely insane.
Oh my God.
I was in it was Denver Airport, and they've got these snaking lines. They go back and forth. Okay. And this woman, like, you just don't even, you don't know what's wrong, but you just know something's wrong.
Yes.
And so every single time that I passed her, I noticed her, and she was young. She was, around my age. And I just kept noticing her. Finally, I was looking for her because I knew, I know something's up. And the last time because we're face to face, you pass.
Yes. Okay. Yeah.
And I'm just like, I got my eyes on her, and she's standing, arm's length away from me, and I just watched the eyes roll back into the back of her head, and she's going down. I just reached out, and I grabbed her by the blouse, and I let her down, took her purse, put it behind her head, and she went into a full grand mal seizure.
Oh.
And then, oh my gosh, the craziest part was that everybody's crowding around me. I'm like, get back.
Yeah.
And I said, I need a doctor. I need help. And these 2 doctors that I worked with in the emergency department showed up. They were there in the line with me.
Oh my God.
Had no idea. And I'm working on this girl. Like, I think I grabbed a pin out of her purse and used as a bite stick. And because she was going after it. And and then I'm surrounded by these doctors that I work with, and I'm just like, what is
where am I
here?
Yeah,
it's so crazy.
Yeah,
it was wild.
I think probably every nurse has at least one of those crazy stories of helping someone in the public.
Oh yeah.
I'm surprised it doesn't happen.
I got a bunch, actually. I had a cement truck driver roll the cement truck, and I mean, it happened. I rolled up. I see him. I jump out. I go up to the truck, and at this point, I'm not working as a nurse, and I was pretty traumatized at that time. And I saw him. He was talking to me, and I could hear the sirens, and I just hung out with him. I wasn't moving him by myself.
Yeah.
And they got there, and I bolted. I was like, I don't want anything. You got help. You don't need me anymore. I'm out.
Yeah. Well, Speaking of that, that's what we're talking about today is PTSD in nursing. And I think it's a subject that you and I have talked a lot about, so it seems very familiar to you and I, and we've actually had to work through a lot of our own PTSD, and we've done a lot of healing from it because we recognize that that's what it was, and so we kind of found the right resources that we needed and have been working on things for that. But I think there is a lot of nurses out there who don't realize that nursing can cause PTSD or associated symptoms with PTSD. And, PTSD is post-traumatic stress disorder, and it's the stress that the body endures during the traumatic event, but then that stays with the body and either stays in the brain, affects the neurochemistry, affects lots of neurotransmitters and hormones in your body, and can literally alter brain integrity, and neural pathways. And
it changes the physical and anatomical structures of the brain.
That is true. Yeah. So today we're going to talk about some statistics and some things about PTSD. We're going to actually do a questionnaire with each other about that, you can do along with us by, just writing down the questions, or we'll link it below just to see if you're suffering any of those symptoms. We're going to talk about some things that happen in the hospital or not in the hospital or as a nurse that you might not think could cause stress and trauma in your body that actually do and can. And so we'll talk about some of those things that are seemingly innocent, but over time can really creep up. And so I think our overall reason for talking about this is just to create awareness, to bring awareness to nurses that, some of the symptoms you might be having, short temper, nightmares, anxiety out of nowhere. And we'll also talk about
drinking too much at parties and telling inappropriate jokes and stories.
Yeah.
Doing inappropriate things.
Doing inappropriate things. Feeling like you need to drink when you come home. Feeling like you can't let down. Feeling like you don't have joy really like maybe you used to, or that other people do with certain situations. All of those things that you might not realize where that's coming from. It really could be coming from PTSD, and that could have stemmed from some situations or just a lingering chronic stress related work environment. That can come from a lot of different things. So we're going to talk about a lot of that. We'll definitely list and link a lot of resources in the show notes. Obviously, this might be very sensitive. And so if you have experienced severe PTSD and you have, you might be dealing with that and you're not at a place in your healing where you can listen or talk about any of this, that you might be aware, please.
I think that's a good segue into what we were talking about earlier, that, as we were discussing the different resources that we can offer to people that are dealing with severe PTSD and mental health issues from their nursing experience, that, we've had our own experiences. And one of the things that we are very aware of is that we aren't the resource. We're talking about the things and we can provide resources, but we are carrying our own weight, and the responsibility of taking on the responsibility of the mental health of the nursing community isn't something that we can carry. So we want to offer resources for you, but we don't, we want to defer to true mental health professionals when it comes to mental health. So, yeah.
I mean, everyone has to create their own healing journey, and we're both still healing. And this is actually part of our healing, which is talking and helping others become more aware of what's going on. The healing has to come from within. And part of that is finding what resonates with you as far as what what resources you're going to use for your own healing. So, that was...
I think there's what just came up for me when you said that is that it's a choice, that you have to make a choice that you want to heal. And until you get to that point where you make the decision that you're going to do the work to make yourself better, nothing is really going to work.
Yeah.
You can, ride the bike, but it won't take you anywhere.
Right.
Yeah.
Very true. Very true. Okay. Well, do you want to, I just have a couple of statistics I just wanted to read, and then I think you pulled up an article we can go over. Let's see who said this. Well, I don't know. Nearly 96% of nurses report experiencing at least one symptom of PTSD. 21% of nurses meet the criteria for a clinical diagnosis of PTSD. And I don't think they know that. As they're talking about their symptoms or things that they do or ways that they act with their kids or, that they have to drink to calm down or to go to sleep, things like that. Those are some of the symptoms that you could have PTSD. And I don't think they really know that. During the height of COVID, about 29% of nurses experienced PTSD, and factors contributing to this high prevalence included direct contact with COVID-19 patients, inadequate protective measures, and intensive workloads. Female nurses are actually more vulnerable to PTSD, and there are studies showing that women are more than twice as likely than men to develop PTSD. And honestly, I don't know why that would be. Maybe just we're more sensitive, or we have a different home life. I don't know why that would be, really, but interesting.
Yeah.
PTSD among nurses can lead to negative mental health, emotional and physical effects, impacting their well-being and job performance. Effective coping strategies and resilience building measures such as mindfulness, meditation, and organizational support are crucial in mitigating the effects of PTSD. Organizational support. I do know that there are, I know of hospitals and people that I follow on social media that are trying to get support like that for PTSD, debriefing, mental health in the hospital. I know that's being worked on. It's not prevalent by any means. And typically my experience has been there is nothing available at your workplace. I think one of the only things that was available when I was having trouble, but I didn't really realize it was PTSD, what I was even dealing with, was the EAP, which is Employee Assistance Program, that a lot of places have. It offers mental health, typically for low cost or free, but it's very minimal sessions, like maybe 1, 2, or 3. And then it would be your responsibility. And I always, I've used it before. And then to find your own counselor, to find somebody who's covered under your insurance, to find, it's like a maze. And so it's not something that's readily available. It's not just you can go down to the counselor's office and sit and chat for a few minutes after you have a stressful time at work. Partly because you can't leave the unit. You can't leave your patients. You can't take that time. You literally can't take that time. But I feel a movement. I feel that there's more talk about this. I feel like it's heading more in that direction. But obviously, that would be years away to where it was mainstream in a healthcare system, to take care of the health of their nurses. And I'm not talking about a poster on the back of a bathroom door. That I'm not talking about.
Right.
I remember during COVID, I'd be like taking my 1 pee break and I'm sweating, my scrubs are wet. I'm sitting there in the bathroom, like, I'm just going to sit here for longer. And you just read whatever, literature is on that the manager put up there on the back of the door. And it'd be like, oh, mental health for COVID, get some rest, do self-care, and you're just like,
it's all on me. It's all on me to do it. Yeah.
Yeah. Like, oh my gosh. I all but ripped those down.
Yeah.
So that's not what I'm talking about. It needs to be much more intensive. So, if you are lucky enough to work in a healthcare system that offers something like that, that is amazing. And you should take full advantage of it. Yeah. And not wait until you should be proactive with your mental health is basically what I'm saying. Don't wait till you're.
So, I mean, when when COVID kicked off, I was working with a nonprofit to set up therapies, basically a debriefing session with nurses, local nurses, and no one showed up. I had managers. I had managers actually from our former hospital. I had lots of people in leadership that were trying to create something, and the feedback that I got from the staff nurses was that they didn't want to engage in a program that would expose their mental state to anyone in leadership. That if they talked, they feared that there would be repercussions. That's terrible. I was shocked when that nurse told me that it was very shocking.
Well, and I can see that. I mean, just thinking back, you don't want to be the weak one, and
Sure.
Still in this society, it's if you can't handle your mind, then you got to get out, you know. And honestly, as a charge nurse, I was kind of like that. I'm like, we got shit to do. Like, people are dying, like
literally dying.
Like, I cannot deal with your tears. Like, get it together. And, if I could only just do it again, but this is why we're doing it now. Yeah. And I don't know. I think it just takes everybody talking and everybody kind of making it mainstream to protect your mental health. I mean, why is there so much stuff out there about proactive wellness and for your body and, cardiac health and, kidney health and, protect your kidneys and do all this stuff, but like nothing for your mind, and I don't know. That's a whole different podcast though, I suppose.
Well, I mean, that's kind of what I've been writing about is like when you separate everything out, like it's great to have specialists, like it's great, but the internist was intended to be the one that focused on the entire person. Mm-hmm. We all know that didn't happen. They're just, they're just the mitigators between the specialties.
Yeah, they order the consults.
No disrespect to the internists. I mean, they're great. They serve their purpose, but when you look at the global system of what we're doing, there's no one that's really looking at the comprehensive person that is in the care of these physicians, and we've just parsed it out. It's like my analogy of the oncologist that's standing over the ICU patient, where the pulmonologist is calling the code, and he's like, "But I fixed the cancer." It's like it's just crazy.
Yeah. Well, it's just all pieced out. Yeah, like.
Yeah, it's all pieced out.
Yeah.
And the mental health part has been severely neglected. And I think both. I think what we put ICU patients through is crazy. We should have some debriefing for them when they survive.
Yeah, no doubt.
Yeah. And why can't we meet them after they've healed? Like,
oh, I know. I loved it when patients would come back.
Yeah, it's like,
You know,
oh
and they'd
my
walk in the unit and you were like,
yeah.
oh, like,
Holy, you never
wow.
recognize them.
No,
I never, like, not off the bat, but
yeah,
yeah, yeah,
yeah, so
yeah,
crazy.
that was great. I think there should be some type
Um,
of program. I think that would heal nurses if we were able to, like, go
oh,
back and see and have conversations with these people that, you know,
yeah,
we're doing all of this work for them, and you know, not that it's without reward, and the work in itself was without reward, but that to see, I mean, that's one of the things that I've thought about is we're designed to have the biochemical reactions of human relationship.
mhm,
And when you take care of so many people, the volumes of people that we care for, and how it becomes faceless, and
yeah,
um, and to have to be able to witness their healing, to witness them as healed, would be just so rewarding for so many nurses. I think there
yeah,
should be some type
yeah,
of program for that.
yeah,
Yeah,
that'd be great. And I think the patients would welcome it to come back and say, you know, thank you, or hey, look at me, or yeah,
yeah, yeah.
yeah.
Tie back some of the memories, like,
Yeah,
when they're in that, ICU psychosis, and they're like,
yeah. Like what
like,
memories do they have?
what,
Yeah.
yeah, like, this guy kept coming into my room,
And
he
he
just
lifted up the
turned me
sheet
over,
every
and
time. Yeah, 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 yeah. He just lifted up the
yeah,
sheet and I just laid there naked.
yeah.
Well, you were getting a bath. Yeah. I was naked. You were getting a bath.
Yeah,
Another bath. You get a bath every day. Yeah.
oh my gosh, that was
Oh
so
God.
funny.
Oh God. Yeah.
Oh man.
Do you still have that article pulled up that you found?
Oh yeah, it's
I mean, just the title is
yeah, yeah, it's
just that
from
they would write an
the
article about it.
what's that?
Just that they would write an article about it.
Well, I mean, that the thing that, like, I did one little search, and I've collected so much data over the years on PTSD, and this was just, I think my keywords were PTSD and nursing, and
Mhm.
the first, like, legitimate document that came up was from the NIH, and the title is Trauma, Compassion, Fatigue, and Burnout in Nurses. And it is interesting because it's looking, it's addressing leadership and its role in managing nurses that have PTSD, have experienced heavy trauma, and the role that they can play in helping them. So within healthcare, trauma-informed care has become an embedded approach in caring for patients. I don't know that I've seen that embedded, but in any system that I've worked in. However, nurse leaders are not always prepared to lead nurses with a background in trauma. Nurses' past trauma coupled with workplace stressors may result in compassion fatigue, burnout, and secondary traumatic stress. I think that's what we were talking about earlier. Nurse leader engagement and trauma-informed leadership approaches are imperative to mitigate and mediate the effects of trauma in nurses as the COVID-19 pandemic recedes. So interesting. We can post that.
Yeah, we'll definitely post that. And so literally, I mean, there's hundreds of articles, and I mean, there's so much out there.
Mm-hmm.
But I think the thing about it is, I wouldn't have ever been like, oh, I've got PTSD, so I need to look that up.
Yeah.
No. So part of what we're going to do today is do this, a questionnaire, and we're going to answer it. He'll answer, I'll answer. And then we'll link it or copy it, whatever, in the show notes so that you can take it too. And just to see where you fall on it. And, if this is something that you feel like might be affecting you, then you have knowledge. It's knowledge.
Yeah.
So the first question is, have you experienced or witnessed a traumatic event that involved actual or threatened death, serious injury, or sexual violence? It would be a yes or a no.
I'm over 20 years. I'm gonna say no less than 5,390. No, yeah, 98 times. Yeah,
Yeah,
that's how
at
many times.
least.
Yeah.
Yeah. So I am a yes. And then
Oh,
it
no,
says how long
there's
ago
one
did
more.
this
There's
event?
one.
Oh yeah,
5,398,
99.
99.
Yeah. How long ago did this event occur? And I think one thing with PTSD, I feel like, and this is the way I kind of thought about it, is there are these huge catastrophes, a big pile up on the shoulder with bodies everywhere, or something like that. But the incidents, it's a like threatened death or serious injury that may be to you, but it also may be something that you witnessed. And so, all of the patients that come in through the ER with any kind of trauma, motor vehicle trauma, motorcycle trauma, violent trauma, sexual trauma. So it's not necessarily happening to you, but you are connected to that trauma by taking care of that patient. And, you're witnessing that. You may not have witnessed the event, but you are witnessing all of the aftermath and all of the family that come in and the crying and the shame. And, as nurses, you feel that because you're so connected to that patient that you're dedicated to caring for. And so that's just a little extra piece of it that, no, I've never been in a terrible accident, or, well, I have, but not injury. But it doesn't have to be that, So, and then it says how long you can have trauma from something 40 years ago, as a child, if you witness something. But, any time in your nursing career, it can happen. In the past month, have you repeated disturbing memories, thoughts? Have you had repeated disturbing memories, thoughts, or images of a stressful experience from the past? And it's not at all, a little bit, moderately, quite a bit, extremely. Since I've not worked in the hospital for a little while, my memories have diminished. But working in an ICU, coming home, you literally dream about it. You dream about it.
You don't wake up to your alarm. You wake up to ICU alarms, vent alarms.
Yeah.
Yeah. I mean, I still, I think I don't, there's probably days that go by that I don't have something, I don't experience something, it's like I was talking about earlier, working in a critical care setting that is not ICU or ER, where people aren't so sick. It's like you're seeing the, a lot of times, because you have predictive measures. You can see somebody that's gonna, you see the path that someone's on, and so when you are able to see that, it brings back the memories of the worst case scenarios of what that illness can be.
Yeah, and I think every nurse can quickly get in their mind and pull up something that they were like, I'll never forget it. Yeah. You'll never forget it. You can smell it. You can feel it. You see it. You can hear what was going on. I mean, it's all senses, and you can get back there just like that. I mean, I have goosebumps, actually.
Well, I mean, that's we talked about that in previous episodes. The the expanding yourself to receive information when someone can't communicate with you, and you're entirely dependent on biological data. You have to expand yourself out to receive as much information from that body, soul, whatever is happening.
And an energy exchange. So,
and I think, that goes back to the story in the line at the airport. My being knew. I knew. I could feel it. I don't know what that is. I can't define that. But I knew, and I knew pretty well in advance that there was something going on. And there
so
was.
Memories, memories can come in just images. It can come in, a full memory. I think the farther out I am from working in a critical care setting, the intrusiveness has definitely slowed down. And, I'll go days without thinking of something. But they're always just right there. Like I could pull it up in an instant,
Absolutely. Yeah.
In the past month, have you had repeated disturbing dreams of stressful experience from the past? I really don't have many dreams anymore, but when I was working, I had them literally every day.
Yeah.
I would dream of working in the ICU. I still randomly will have a dream of being in an ICU. But when I was working almost every night, I worked my shift. Then I came home while I was sleeping. I literally worked another shift.
Oh, shit.
I mean, it was
my God.
full,
That's terrible. Oh,
in the
man.
unit that I worked. I know I was exhausted, and we wonder why we're exhausted.
Yeah.
So yes, anybody who's working any kind of job, if it's intense and you're doing things, it's in your front mind. I mean, you're going to dream about it, but the repetitive dreams, the stressful dreams that wake you up, nightmares, and it doesn't even have to be about the hospital. It can be anything really, if it's intrusive.
Sure.
In the past month, have you suddenly acted or felt as if a stressful experience were happening again, as if you were reliving it? Reliving experiences is key.
I experienced that.
Yeah. And it didn't happen to me a lot. I think I just got really good at blocking it, but I do feel like there are people who that's happening to, and they might not even know. And
well, I think that, but I think you were, again, going back to earlier when I was sharing, like I made a little joke about it, that we're always scanning the public.
Yeah. Yes.
That's that.
That's
like,
that.
It's going to happen again. And I need to be watching everyone.
You are ready.
To make sure that I'm ready to take care of
and aware
whoever needs me. And then it raises the question, like, do you create that? I don't necessarily know. It's an interesting question.
It is an interesting question.
There's any way to know that though.
Yeah. Interesting. In the past month, have you had physical reactions, for example, heart pounding, trouble breathing, sweating, when something reminded you of a stressful experience from the past?
Yep.
Yeah. When you think of it, or for me, sometimes it's not, I have experiences, but for me, it's just this general time. And so if I can, like the time that I worked in ICU or during COVID, because it stretches out. It's not just an incident one, it's all of it. And,
well, I think it's the compressive force of the way that we're trained in nursing school, that you got a pathophys test. So, you don't really get to debrief the experience that you're having. You just have to look at it purely objectively and ignore the emotions, the subjective experience that you had, and then go study for your next patho or farm test.
Yeah.
And then that trend just carries through your career, that you just keep moving forward, and it's just not even a thought, which is why nobody knows. That's why nobody thinks that they have PTSD, because you just keep moving forward to do the next thing.
Exactly.
Until you can't.
Yeah. In the past month, have you avoided thinking about or talking about a stressful experience from the past, or avoid having feelings related to it?
Yes.
Yes.
I mean,
have you avoided? Go ahead.
There are, there are stories you can only tell to nurses,
right?
Other healthcare providers, and there's like the fear of what would people think if I told you this whole thing that you just reminded me of.
Yeah.
What would
No,
what
you
would
don't
you
say.
think of me?
I know.
Like,
Well,
yeah.
I have a funny story. During COVID, I don't know if I had gotten off work or I was getting ready to go to work, but I was at my sister, or maybe we were just there. But I was so broken. I didn't really even realize that. I just thought, I'm doing this. I'm a hero. Call me a hero.
Yeah.
I'm doing this. And I was standing at an island in a kitchen. I was on one side and there were several people on the other sides. And they were kind of asking me, because, I think people really didn't know what was going on.
Sure.
And I said, yeah, it's bad. And that's pretty much what I would say. But this day, I was like, you don't even know. If you come to the ICU, you're dead. Everybody who comes to the ICU, you get on the ventilator and you're dead. And I just went off in this weird psychopath tangent. And when I kind of came out of it, they were just all standing there like, looking at me like, well, it's okay.
Yeah.
You can go to work or what?
Yeah.
Leaving now? Like, get out of here. But nobody could say a word. Nobody could say a word.
And then how did you feel like after you've processed that? Like later,
Well, I just thought they must think I'm nuts.
Yeah.
And did they really hear what I said? Like, that doesn't even capture it even, I
don't, that's why I stopped talking to anyone around me that like,
they don't know.
Because no matter how articulate I am about, I don't know, like, putting my hands somewhere in somebody's body to hold pressure so they're not bleeding out, because, that happens. And, no matter how articulate I could ever be, I could never communicate to the essence of what the experience was. And so I just stopped talking. No. I just stopped telling the stories, and then I'm just holding it all in. Like, that's not good.
Yeah. No, it's not. It's damaging. It's very damaging.
It's damaging. Yeah.
Very damaging. And I think a lot of nurses really, after COVID especially, couldn't talk. They didn't have any words for it. It was more than anyone's eyes should ever see. And, a lot like people in the military, and people, soldiers who go to war and have to see that kind of violence, it never leaves. It never leaves you.
Yeah.
In the past month, have you had trouble remembering important parts of stressful events? I guess we do, because when we talk about stories and you're like, no, you were there. And I'm like, well,
yeah,
I suppose I was, but I don't remember.
Hey, there's your cat again. Oh, they went up.
Yeah. So,
that's funny.
There's definitely pieces that our brain, doesn't, if you're trying to recall something, it's the recall, the recall, I guess.
Yeah.
It's just not there.
Yeah.
Have you had strong negative beliefs about yourself, other people, or the world? For example, I'm bad. No one can be trusted. The world's completely dangerous. So those would be like, generalizations of basically just your poor mindset about everything. You've seen the worst, and so everything's bad, or you're scared to go outside, or you're scared to let your kids jump off the couch, Yeah.
Yep.
So it definitely bleeds out into your home life, your life with your husband, your own self in the world,
how you view the world. Yeah, absolutely.
Yeah. In the past month,
are you keeping score? Are you keeping score of this?
No.
Oh.
So
why? What's the point? It's basically yes to everything.
Well, yeah. So we'll put it in the show notes, but it is not at all, a little bit, moderately, quite a bit, or extremely. So then it's going to categorize, you know, kind of the level. And so I think really we're going through just the questions so that they can kind of get a better understanding of what it is. But I think it's yes to everything. But there is a, you know, scoring. And basically, you know, it says count the number of responses that are moderately, quite a bit, extremely. If you have multiple responses in these categories, it may indicate symptoms of PTSD. So that's really what that says. In the past month, have you blamed yourself or someone else for the stressful experience or what happened after it? I guess that would be, well,
yes,
you know, blaming the doctor, blaming,
yeah,
you know, blaming, you know, because and when these situations happen in the hospital, it's not particularly blame. It's because they happen. They're happening. But I think, you know, in my own mind, you're like, sometimes I blame myself for sure. Sometimes I blame the system. Sometimes I blamed who was on call. Sometimes I blame, you know, that we couldn't get the medication in time, you know, things like that. When really none of that actually really matters. But I think it's just your mind trying to work it out and make it somewhat okay by trying to do that.
Yeah.
In the past month, have you had strong negative feelings such as fear, horror, anger, guilt, or shame? That's a huge loaded question.
Yeah. Yeah.
Yeah. I mean, I think that was my overwhelming sense of self, especially after COVID, you know, and I didn't know where it came from. That's the thing, you know? So you have this anxiety, you have this anger that's coming from seemingly nowhere, you know, you freak out on your kids for nothing. You know, you're mad at yourself for, I don't know, not making the green light, you know, little things like that to where your emotions are exaggerated to the experience of what's happening. And then just shame. And it might not even be shame regarding the actual situation. It just might be a sense of shame. I'm not good enough. I don't know if I should be doing this. I'm not a good mom. I snap all the time. I drink too much. You know, I feel bad about whatever it might be. You know, that's a symptom of the stress that your brain is trying to handle.
I think that's where you get into the cycle of, you know, you experience the thing that is kind of at the core of the shame. Like I was saying, I stopped talking to people because of the essence, but there's also the judgment part that if people heard me tell my stories, like all of the things that I've done as a nurse or as a man or whatever, the shame that I would feel, or the shame that just the idea of sharing those stories of, you know, this person bleeding out on me and there was nothing I could do. And then how they would look at me how they would look at me because I had that experience is I think that is the source of the shame that because in my mind, I'm projecting onto them that, that they're going to judge me and in a negative way because I had that experience. And that creates the cycle that ends up, if not checked or taken care of, it ends up in the maladaptive behaviors of, you know, anger and alcohol and drugs and sex and all the different ways that you can, you know, I guess mask or avoid dealing with that shame. And
totally. And sometimes you don't even know you're doing it. You know, sometimes you might get a drink, you know, because you're like, oh my God, what a shitty shift, you know, I'm drinking. But other times you're drinking and it's so subtle, but, or whatever you're choosing to mask with is so subtle that it doesn't seem like that's what you're doing. You might just be enjoying life or, you know, relieving whatever your stress, but it really is a mask, because when you're doing those things, you're not in yourself. You're not with your own soul. You're disconnected. You're,
For sure.
You're disconnected from yourself.
Yeah, I don't think I ever, I mean, maybe, I just don't remember. Like, I was always too tired to go home and drink after a shift.
Yeah, I never did either, because I was just so, like, I was nauseous almost. I was so tired.
Yeah. So that was, I don't think that I did that, but I do know that when I let loose, it was all out. There was nothing holding me back then.
Same.
And I mean, there are some terrible stories of drunken belligerence that of course I'm embarrassed, and like, but I was embarrassed. I don't expect people to understand that. I think nurses will understand that. I think nurses that have experienced what we've experienced, and just like I don't even know really how to describe the feeling of that, of what I was doing when I was letting go like that. I think there's something to think about there, because it's like, you're masking, some tremendous experience that you had. You're trying not to remember that. And so it's like this, like, I don't know, this idea, like, I think it was Eckhart Tolle. I listened to him describe his spiritual awakening, and he was like, I was having this fight or something like that, and he was in this struggle with himself, and he was like, he said, I don't want to be, I can't live with myself like this anymore.
Yeah.
And it caused him to think of himself as it took him to an observer level of himself, meaning there are two parts of me. There's me that's this.
Yeah. And
then there's the me that's observing this. And the me that's observing this can't do this anymore.
Yes.
And so
they don't match.
Yeah, they don't match. And so I think that idea could be overlaid into this conversation of masking, like trying to get, like, I don't want to think about what I just saw, this week, or, because it was never after work. It was generally on the weekends or on a day that I had off, and it would just be belligerence. It would just be stupidity. And, like that part of me that was observing all of that experience, so let's call that like the core self that's observing this. And I'm motioning to anybody that's just listening. I'm motioning to my body, this, like the part of me that's observing this body do the things that it's doing. I lost it. Where I'll get it back.
Well, you were just trying to describe the disassociation from, the body that's here on earth that is working, and then your soul basically watching yourself, and I felt the same way. That exactly describes when I've decided to quit drinking, is because my soul decided we can't be together anymore. So you have to change this body. Your earth body cannot go on drinking as much as you're drinking, because it's causing chaos, and there's too much conflict between your soul and what you're actually doing. And that is a terrible feeling. And I had that feeling I had that feeling for, I mean, oh my God, probably 15 years. And, you know, tried to moderate and try to do all that kind of stuff. But that describes it completely, is my soul could not do what my external body or my earth body and mind were doing anymore. It couldn't connect. It was too much. And I think that's where the decisions are made. So that explains it perfectly.
Thanks for landing the plane. Thanks for landing the plane for me.
You're welcome.
Yeah.
In the past month, have you felt distant or cut off from other people? I think I know that was, I'm working more now on my connections. It's deliberate. I have to do it deliberate because isolation is a real deal. And and I know for you for sure.
Yep.
Even within my family, even within my home, you know, I was isolating and not really by choice. You just withdraw, you know?
Oh, for sure.
And so, think people need to think about that. Have you lost interest in activities that you used to enjoy? I mean, I think that goes right along with the isolation. That was, you know, you just wake up, nurse, go back to bed, wake up, do it again, wake up, do it again, maybe see your kids, you know?
Yeah.
Have you had trouble experiencing positive feelings, like being unable to feel happiness, having loving feelings for people close to you? That was me at the end for sure. And I didn't know why, though. You know, I thought, what is going on? Like, why do I feel like this?
Yeah. No, I've spent a lot of time processing relationships that I've had, and the different ways that you attach to people, and like, I haven't dated in a very long time for that reason. Like, I needed a complete reset. And I mean, I still have work to do. I don't know. I think there's hope that I can get to get to the place where I don't feel like I have to focus on myself anymore. I think I'm close to that, but I think, like, I know, like, gosh, there's one person that I worked with. I won't give any identifiers, but this person was a severe sex addict, and this person, I think we worked in the ER together, and this person would tell me stories, and I was just like, how will you ever survive this? Like, how will you ever have any intimate relationship again? And I think that because the volume of people, like I was saying earlier, the volume of faces that we see and how numb we become to that makes the human interactions, it makes how we connect, it makes it more difficult for us to connect in a really truly intimate way.
For sure.
And I think that's what I'm talking about when I'm saying, I think that I believe, I know that it's possible to get back to a healed place and form healthy bonds.
Yeah, for sure. It is. But I think recognizing the unhealthy bonds and I didn't know, it just makes more sense to me now. Some of the ways that I was feeling, about people that I loved and that loved me, almost like I couldn't really let it in,
Yes. Yes.
Yeah.
Yeah. I questioned love itself.
Yeah. You just are very, like you build this exterior, like this shell almost of like, I can't take any more.
Yeah.
I can't take any more pain.
Yeah.
Yeah.
But then I think that, so like the idea of the soul or the self, and like, almost like that those, you know, the letting loose and going to the bars was carrying that part of my soul forward. And then at the end of the day, after you start to heal things, then it switches, and the true essence of who you are begins to lead that baseness forward into the future. And that's, I feel like that's when you begin to heal.
Yeah.
When that part, when that true part of you is carrying you forward, then
it's like the strength of the soul steps up and says, "This, we've had enough.
We're not doing this anymore." Yeah,
we're not doing it.
Yeah. I think there's movies like that. I think there's movies with that theme.
We'll have to come up with one.
Yeah.
Have you been overly watchful or alert, checking to see who's around you, being on guard, jumpy, easily startled? I think actually during COVID I was. I don't know. You are though, aren't you? Are you still?
Still, which part? There's
jumpy.
There.
Yeah, jumpy. Watchful.
No, not like I used to be. Like I used to be. Occasionally, if I'm super tired, like my sleep, if my sleep hygiene is off, then I get more jumpy. But not like it used to be.
Yeah, I feel like once you kind of recognize what's going on with yourself, you can. That's pretty. I mean, it depends on how. It depends on the person, honestly. For me, once I recognized that, it was easy for me to be like, oh, okay, that's what that is. To name that stuff, so I didn't have to feel so scared. Yeah. But also, I think you did.
No, go ahead.
I think that can also manifest just as general anxiety. Just anxious.
Yeah. Well, I mean, the hypervigilance, like the looking at everybody in the public, like I think that was part of that question. Like that describes that to a T. That's
exactly wondering.
Who's going to go down in front of me?
Who's going to go down? Who's it going to be?
Yep.
Then of course it's talking about your sleep. So that's really all the questions.
But then the other part of that jumpiness was the being prescribed Adderall when PTSD, that it was really an inappropriate medicine. And it's my own fault, but I don't blame anybody for that. But the PTSD is a nervous system issue, and when you throw on Ritalin or any of those stimulants, it's just burning your nervous system. You're just turbo boosting. Yeah, it's just making it. Yeah, it's turbo boosting that nervous system, and it basically just fries it. And that's where my jumpiness came from, and just the whole thing, all of the sleep deprivation and dehydration. Drinking water is so important. It's incredible. So I think.
Well, so not only do you have the PTSD from what we see and feel and experience in nursing, you have all the other stressful factors of just being a nurse, 12-hour shifts, your feet all day, with your back pulling 500-pound patients, only getting one pee break, barely getting a lunch, or shoving it in your mouth or I would go in the break room and I'd be like, okay, everybody good. I'd get the dressing on my salad. Just, oh God. And it was going to be so good. It was so good and green and crispy. It was like, 2:30 a.m. And then code or someone calls, hey, we need you, And you go like you can't do anything with it. The salad dressing's already on it. So it's screwed. Yeah. So many times.
And then you're, oh man, I remember I was stuck in a patient's room forever, and it was something nasty. I don't remember exactly what it was, but one of y'all was feeding me pizza at the door. I was just taking bites at the door because I couldn't do anything else.
Oh God. Yeah. You couldn't leave the room.
You know, I
Yeah.
gotta eat something. I'm gonna fall down, but I gotta keep going.
Yeah.
Yeah.
Yeah. And just all of that stressful. Night nurses. Oh God, love the night nurses. Night shift is so fun, and it's such a different environment than the day shift, and I loved it. And I would encourage, I loved it, but you don't even realize the toll that lack of sleep takes on your body, and trying to make yourself sleep during the day. But, I have no answers. Like, who's going to take care of the patients at night?
Yeah.
I don't know. And, it's like there are career nurses who work night shift. I worked night shift for 22 years.
Wow.
And I mean, I'm still trying to get right, with just everything. My nervous system, my sleep, it is drastically improved. But when I made the switch to day shift in 2018, I had to be on, I think I was on Adderall. I asked for that stay awake med, but that wasn't covered by insurance. But he was like, but I got some Adderall. And I thought, well, so I was taking sleeping pills and Adderall. But I did I did keep it at about, because literally I'd get up in the morning, and on my way to work at 7:30 in the morning, after I slept the night, which I could pretty much sleep all the time, but I slept the night, I would fall asleep on the way to work in the morning, drowsy. And then in the afternoon, 2:00 in the afternoon, in the shift, I couldn't keep my eyes open. So it's like those one nurses who come to night shift every once in a while and try to work a night shift, and they're giving you a report and they're literally falling asleep like they have narcolepsy. It was like that, but I was on day shift. I had this, and I knew I wasn't going back to night shift. I did end up doing that for a year, but so I gave myself 6 months to get right on the Adderall, and then I stopped taking it because I knew. I knew.
Yeah.
And we do amazing things, and our bodies are amazing for tolerating all of that.
Crazy. I remember driving home and sitting in my driveway and going, "How did I get here?"
Yeah.
I
know.
I don't remember driving home.
Or
being drunk, I think.
Yeah, putting the car in park at the stoplight just because you were afraid you might fall asleep and step off the brake. Or just close my eyes for just 1 minute. Just 1 minute. I'm so tired. Oh God, being so tired.
It's terrible. It's terrible.
So I just wanted to go over a couple things that nurses might not think of as something that could cause trauma, mental trauma. There are things like, obviously, workplace violence. If a nurse is in an altercation or there's hostile patients, which honestly we've been around, we make light of it and we joke about it. But even if you've never been on the end of a kick, you've still dealt with a violent patient and having to either 4-point restraint, hold them down. That's very, I think how close you are to their body when you're holding them, to try to get them calm before they, rip their ET tube out or, pull their art line out or get out of bed and run around the unit naked. That just, and it just says high stress situations. Nurses routinely handle high stress situations such as resuscitations, managing critically ill patients, responding to emergencies. These scenarios can lead to burnout and PTSD. That was every shift.
Imagine that. Yeah, every shift. Yeah.
Every shift.
Yeah.
And we talk a lot about critical care, but those med-surg nurses who manage 6 and 7 patients.
Oh yeah.
I can barely do that. When I would float up to the floor, I barely handle myself. So that is also so stressful, managing all of that. Discharge, admits. Just that level of stress is damaging. Just being there at work.
Oh, absolutely.
Yeah. And lack of support and resources. We all felt that. Inadequate staffing, insufficient resources, lack of support from management, and exacerbated stress contribute to mental trauma. Nurses who feel unsupported are more likely to experience burnout and PTSD.
Yeah,
I think that's
absolutely
common. It's sad that it is that way, but I mean, it's a moneymaker, and nurses are expendable. They are an expense for the hospital, and a lot of times we're treated as such. When they flex down staffing at like 2 a.m., how do you know it's coming through in the next 5 hours? We got to send somebody home because somebody died. We can't just like take a minute. No.
No, get out.
That's very stressful. Yeah. That's a lot of and just the emotion of it, thinking like I'm human. Like, I am human taking care of other human beings. We're not talking about a tech company. We're not talking about printing. This is real human life. And a lot of times we as nurses are not treated like that. It's a numbers game. It's a numbers game. And I saw that hugely when I got to management, which I only did for a year and a half. I couldn't tolerate it. But
and then there's also like the play on altruism that they'll, we need you. But then at 2 a.m. after that guy dies, get out. Yeah. So
get out. And if we get admissions, we'll make do till 7 a.m.
Yes, and put it all on everyone else. Yeah.
Mm-hmm.
It is the altruistic nature of nurses that's being preyed on. I think. Yeah,
it really is, and that's sad.
It's very sad.
I mean, the whole thing. Yeah. It just mentions intensive workloads, long shifts, which we've already talked about, exhaustion, lack of sleep, lack of water, lack of being able to pee, lack of all of it. 12 hours, that is a long time. But I get it. I get it. I didn't like 8-hour shifts either. I don't want to be there 5 days a week. So
I don't want to be there 5 days a week. Yeah.
No.
Do you find that you're more sensitive to the moon after working 20 years in the night shift?
Oh God, yes. Oh
like
my
you
God,
feel it. You know where it's at.
Yes.
In the monthly cycle. You can't understand that unless you've lived it.
Right.
And I think
people joke, but the moon is energy, and the moon is it cycles the world. It runs the oceans. It is the cycle of life. And so of course it directly affects everyone. Right. And so lots of things happen on full moons. And in a hospital, I remember taking a picture on my way into work one night. It was full moon, 4 ambulances in the ambulance bay when I got there.
My gosh.
Oh my God. And you just drive around that. You just know. I mean, it makes me, it's the energy, and it just makes people crazy.
Yeah.
And yours is crazy.
I actually think I don't think it makes people crazy. I think it brings out what's inside.
Well.
Yeah. Like if you've got good things inside, I think it brings those up. And I think if you've got negative things, it brings those up. That's just a little working theory that I have.
Yeah, I would definitely agree with that. I thought maybe you would want to talk a little bit about your experience with Warriors Ascent.
Yeah, I mean, just we can. It was a pretty profound experience. Finding that, I went through that in 2017, and when I went through, they had diagrams of the anatomical structures of the brain, and they had, in the diagrams, it had the biochemical markers that are triggered with stressful traumatic events. And as I'm sitting there watching these presentations go on and on and on, it's just like I felt so foolish that I know all of this stuff. I have a degree in this. Why couldn't I recognize it? Why didn't I see that this is what I was dealing with? I had no. It was just such an eye-opening experience to sit there, and it really gave me it gave me a perspective of myself that was kind of an outside objective. It's like you have been through some serious stuff, and this is what was happening in your physical body, and you can change it. So the thing that Warriors Ascent gave me was the idea that I have a toolbox for healing myself, and that their role, their job was to fill that toolbox with as many tools as they could give me. And then from there, I left with my toolbox to heal myself. And I've been working on it. I mean, I was working on it before that, but I've been utilizing those tools that they gave me ever since. And, it's not the only organization. My Battle Within is another organization that does a similar thing. There's another organization in Kansas City called Healing Heroic Healers that has helped me a lot. Amazing organization. What they're doing is so awesome. And then Horses and Heroes and Horses. I had it on my Facebook profile. I did a little fundraiser for my birthday. Heroes and Horses, I think. Horses and Heroes, or Heroes and Horses. It's one of the two. I'm sorry, I forget which one. But I've done all of these programs. I didn't do My Battle Within, but I know people that are in that organization. It's an amazing organization, and it is helping people. So all of those, and we can provide links to all of those services. And I know that when I went through Warriors Ascent, there were guys that were from, I think, as far away as California. So it wasn't just local people. They were coming from all over the place. So there is help out there, and I would love to see something specific for nurses someday. Maybe that's where this goes for us.
Yeah.
Maybe we create that. That would be so awesome. I would.
Yeah.
There's nothing I would rather do than create something like that. Yeah.
So we will.
I have a picture. Yeah, I have a picture that I will that we can post to this. But they did a before picture and an after picture, and put them side by side. So it was the first thing that happened when I showed up for the program is they took my picture, and it's male cohorts and female cohorts, and you put a bunch of traumatized guys in a room, and it's an aggressive room. The intensity of that room, it was just like threats everywhere, and it's on every guy's face. It's just like just feeling that room out, because every single one of these guys has been through the ringer, man.
Yeah.
And so the pictures are like the before picture is so rough. It's so hard. And the after picture is so light, and like it was such a dramatic change in 1 week. I credit that program with, I mean, it changed the trajectory of my life. The knowledge and the skills that they gave me there were invaluable. I would not be here I would not be a nurse if I hadn't gone through that. I would still not be working as a nurse. So amazing.
Yeah, really amazing.
Yeah.
Well, this was a really good conversation, and I think a really necessary one. Again, just making people aware, making nurses aware that, some of what might be going on in their life, that, if they're not as happy as they want to be, they're not as free, they're not, they don't feel like they really are who they want to be. It deserves a look within. And, you know, if you any of the criteria for, you know, PTSD and, you know, any of this makes sense to you or resonates with you, or, you know, even if it's just some of it, you don't have to meet all of it. It's just some of it, you know, you may be suffering and from this, you know, from PTSD. And once you know, then you kind of can move towards those modalities of healing. You know, it's a place to start for people who just don't know what to do.
Yeah.
So, all right, everything will be in the show notes, and we will see you next week.
Awesome. Thank you. We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below, or by visiting our website.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.